They came from all over the country. NHS workers who say they're facing the biggest crisis of their working lives. With record A&E and ambulance waiting times, putting people's lives at risk, they say. An unbearable thought for those who spent a lifetime on the front line.
I'm a retired paediatrician. I've never seen such fear and demoralisation in NHS staff in my life. A quarter of trusts are running food banks for their staff who can't afford the cost of living. So we will carry on losing staff and not be able to recruit new staff unless the government wake up and say and treat the public servants that they are with respect and pay them a decent living wage.
We are the nurses. We are the nurses.
But no such offer is on the table, according to unions. And all the while, these nurses say it's the patients who suffer.
Patients aren't getting the right things done for them because there's not enough staff there to provide it. That's the bottom line. Every single day, patients are suffering. Nurses are suffering. They're suffering from burnout. They're suffering from low morale because our government have completely abandoned us. They stood out on the streets and they clapped for us, and now they've turned their backs. You know, it's devastating. It's heartbreaking to me.
Her emotion echoed by many here.
People here are angry. They say they're overworked and undervalued, and they had to take to the streets to fight for the future of the NHS, a future which they say must start with increased pay.
Without it, the health service will continue to hammer its staff, this junior doctor says.
I open up Instagram and I see ads to go work in Australia, to go work in New Zealand. This government, they will recruit, from abroad, and there are huge ethical concerns in that. But why aren't they talking about staff retention?
In response, the government said, "We have prioritised health and social care services with up to £14.1 billion over the next 2 years, on top of record funding. We're also making progress to recruit more staff, with more than 4,900 doctors and almost 11,100 more nurses compared to a year ago." But support for workers today came from a familiar face. Actor Rob Delaney, whose young son was treated by the NHS before his death from cancer.
I lived here 9 years. So that means most of my life was spent getting health care in the United States, with a really horrible barrier of private health insurance in between me and my family's care. In the UK, you don't have that, and it's spectacular. So I'll fight for the NHS until I'm in the ground.
Everywhere we go.
A fight that workers here say they're ready to continue. Milena Veselinovic, Sky News.